have chemo before surgery or chemo straight away?
So I had 4 rounds of chemotherapy before my surgery to shrink it all down to a point where actually it was operable. And then a further 2 chemos afterwards. What about you two?
I had 3.
Yeah.
And then surgery, and then another 3.
And I had surgery first, and then 6 rounds of chemo.
How did you feel about having surgery?
I was quite apprehensive, I think, because they said that I could have surgery, but they were unsure about everything that would be involved until they opened me up. So that was quite nerve-wracking.
Yeah,
But the consultant, she was very good. She put my mind at ease and just made me feel confident that she knew what she was doing, basically.
Yeah.
So yeah.
How did you feel about surgery?
I was ready for it. I thought it was such a great landmark. It's a great milestone in your treatment, particularly if you've done chemo first, because it's the moment where you actually get to remove the primary tumours, and that feels so important and so positive. I was tired from the chemotherapy, and was glad of the extra week or 2 of recovery in order to be ready for it. But it felt like a really positive step.
Okay. But I did feel like I was wanting the surgery. I wanted
I think
whatever's
it's a psychological
there.
thing, isn't it? You want it out.
Yeah,
basically.
exactly.
So,
yeah, and when he said we can do surgery, I was like excited in a good way.
I certainly remember when they said we're going to do chemotherapy first, being disappointed that we weren't going to get rid of those big tumours to begin with. And there was a sort of an adjustment of going, actually, we're doing the chemotherapy first to give the best possible opportunity with the surgery.
So they can get everything.
Yeah, exactly. Because I think when you're first diagnosed, you just want it out.
Yeah.
And so you have to trust the oncology team and the surgeons to do that multidisciplinary team meeting and come up with the very best treatment for you in your circumstances, rather than just, following a script.
Yeah.
So when you were going in for surgery, what did you do to prepare and what did you take with yourself?
So when I met my surgeon, she basically said to eat as much protein as possible because that will help with the healing, and walk, just get out walking to try and build your fitness up. So I started to eat chicken and fish, and basically just walking the dog as much as I could, and I think that helped physically but also mentally, just to clear my mind and just to get that fresh air and everything. So that's what I did to prepare myself physically and mentally for surgery.
I had a little given a ganache guard, an ornament, years ago, and I used to just have it as an ornament. I wasn't very religious, but since I've had cancer, I've become not religious, but I believe there is something. And ganache is my little pal that I bring it everywhere I go. It's at my son's house right now on the bedside.
Yeah.
That gave me strength.
For me, it was, I wanted to take something with me that was about the me who wasn't having cancer. So I had a photograph of me and my wife next to the bed, with me with a full head of hair and looking my best self. And so it opened just a different kind of conversation. In really practical terms, I remember the thing I was really grateful for was I brought an extra long phone cord. So actually I didn't have to keep reaching round for it. It was actually quite close to me. So just, that purely practical. I completely overpacked. Oh my goodness me. I took
did as well.
So much stuff with me. In the end, I think I was in hospital for 8 days. I used their gowns the whole time. I was glad I had a sponge bag with, things that smelt nice for me, and the soap that I knew and loved. But other than that, slip-on shoes. Oh, I wish I'd had slip-on shoes when I left. so I didn't have to lean down and lace them up.
Oh yeah, that's a good point actually.
Yeah.
I just used my slip-on trainers to.
Yeah.
Yeah. No, I was the same with you with the photo. So I had a photo of my husband and my little one. So that was my focus. When I was in there, and it was nice to talk about them, with the nurses rather than what you're going through.
Yeah.
And colouring book. Once I got a little bit better, because I was in for 10 nights in the end, the colouring book was a godsend. So I wasn't in the right frame of mind to watch things, but the colouring was
that's good.
Yeah, it was really it was like a positive quote colouring book. And it was just nice. It just gave you something else to focus on. And
And I think the other things I was glad of, I had a cotton scarf with me because I was near an air unit, and there was actually a cold draft that meant I could sort of cover myself over. And also, making sure you got your hat right.
Yeah.
The thing about losing your hair is it can be cold, can't it? Other things I'm really glad I did. I sat down with my wife and went through all the people who needed to be told that I was coming out of surgery, and those who I was happy for a text, and those who I really wanted her to ring, so that I was completely relaxed that everyone who needed to know that I was okay would know as soon as I was out.
We did the same. It takes the pressure off you, doesn't
Exactly.
it?
Off you and off whoever it is who's sitting outside and waiting and worrying. So I was really glad we did that.
So Sarah, what was your experience like with surgery?
So I was nervous, like I'm sure all of us were. The team were really reassuring. I had two surgeons, the gynaecologist and a bowel surgeon, because there was a very real chance that I would lose a part of my bowel. In advance, a stoma nurse went through with me where a stoma would be sited, and what would be best for me, so curves of my body and my clothing, and talk to me about what that would mean and how I'd look after it. So I felt very well prepared. On the day, a little bit of a delay going down, but they kept reassuring me that it would be okay, kept me informed of when I was going down. Epidural when I arrived in the pre-op room, so you feel your legs going numb, and then very quickly you're off to sleep, and before you know it, you're in the recovery room.
I had a lot of family support on my occasion. I was very scared. I'm sure both of you were on the day you go into hospital, and saying your goodbyes to your family and saying, and I was one of the last ones to go down to theatre. My team was excellent. They reassured me I'd be okay. I had a surgeon that was very comical. So that helped.
Helps.
Yeah,
that definitely helps, doesn't it?
That helps.
I don't remember an awful lot about the recovery room. I remember that the epidural had worn off, so there was a flurry of activity just to get on top of the pain, but the team were just absolutely clearly focused on me, how did I feel, and making sure that I was comfortable and felt good. And I actually ended up, talking to my partner that evening on the phone, where actually neither of us had expected that.
That's really good.
Especially if you're evening surgery.
Yeah, absolutely. Yeah. And I have a very clear memory of sitting up in a hospital bed with two of the nurses watching an Adele special, feeling great, with my stomach, just not emptying. And 5 days later, for no apparent reason, it started working again. And it's that thing of things happen. They're expected to happen. They're normal. It's not normal for you, but it's things the medical team have seen many times before, and they're confident about treating it. And you've just got to trust them. It'll be okay. And then going home, it was having the right support. I underestimated how different it would feel leaving the hospital. It feels like a very safe environment, and then going outside felt like a really big change.
Did you feel very vulnerable?
Yeah, I did. I did. I was really glad that someone came and actually picked me up, who I trusted, and took the time to make sure I was sitting in the car comfortably and everything. And then, getting home, actually letting people do things, because I think all of us want to be up and doing, and actually letting other people help, and doing what the doctors say, not lifting anything, not doing anything, and giving your body a chance to heal, not just on the wound that you can see, but internally, because all those muscles have been cut and they need time to knit back together. And getting up and walking, at home as well.
Definitely.
How about you, Anita?
For me, similar, very similar to both of you. It was Diwali when I got discharged.
Oh wow!
And my family, my brother had come from America, and my 2 sons and my husband and sister-in-law, they decorated the house. And I remember driving up the drive saying, "Why is the curtain closed at 4 o'clock?" Because they obviously didn't want to let me see what they'd been doing. And so I was moaning, and then I got in my hospital gown, and it was lovely. It took away all the anxiety for that first hour of feeling frightened at home with no nurses next to you. That was important to me to if something went wrong, I've got no nurse next to me. And so that was brilliant. When I got home, it literally I felt very loved. I am loved, but I felt very special and forgotten about the big op that I'd had. But moving my family helped me lots, doing little baby walks. And I had a brilliant support.
I don't know about you, I got sent home with a telephone number for the nurses.
Yes.
I was so glad for that. And there were a couple of times where I just wasn't sure about something, and I rang them and it immediately put my mind at rest. Just have someone who you knew you could contact, who understood what had happened, and you could quickly reassure you, or tell you what to take or what not to take, what to do. That was great.
Was really hard for me because I have my daughter's 2, so she wants cuddles, and your natural reaction is to want to pick them up. But I just used to sit down. She used to come to me for cuddles, so that was good.
I look back at it as being a really important milestone in the treatment, a really positive step. Yes, the recovery takes time, and you need to give your body a chance to heal and recognise that it is a really major surgery. But I've got no discomfort, no side effects from it, and it was actually a really positive experience.
Definitely.